Good morning, good afternoon, and good evening to everyone from where you are joining us. Thank you so much for participating in this entries of tinyML Talks. Today, we will have Jallow, product manager at MarsCrowd, to talk about application of actual low power and resources constrained devices to improve healthcare delivery in resource constrained communities. My name is Lily from C Studio and Chaihuo Makerspace, and also one of the organizing committee of tinyML Shenzhen group. I will be the moderator for today's tinyML talk. So at first, we'd love to thank all our tinyML talk strategy partners: AOM Devices, DeepLight, Edge Impulse, Emma Visual Science, PhotoHub, Greenwaves Technology, Gravity, HOTG, ImagineMob, Etermus, ClickAttack, Lantern AI, Messing Integrated Micro AI, NSP, Prophecy, Qualcomm, Quizzo, Reality AI, Rhinoceros, Racing Technology, SAP, C Studio, NCDs, Sony Semiconductor Solution Corporation, SD Microelectronics, String Analyze, SyncSense, and Sentient. And if you'd love to support the emerging tinyML community, additional sponsorships are still available. Please contact Olga through the email list on the slide. And then also, here we would love to share a trailer for our upcoming in-person events, the tinyML Summit 2022 and tinyML Research Symposium, which will take place in San Francisco on March 28 to 13. And you are all invited to register for the event. And then our next episode of tinyML Trailer Blazer series, we will have Professor Marion to share her successful story on March 22nd. And then you can scan the QR code to register now. And then here, we also love to invite you to join our growing global tinyML communities. You can scan the QR code to join our meetup groups or our linking groups, where more than 10,000 members are gathered to share and to communicate. We are also having a tinyML Shenzhen community that runs both online and offline events. Welcome to join us in our meetup groups or scan the QR code to join our WeChat group. And most importantly, we are calling for speakers for our upcoming tinyML events. And then please apply if you want to share your journey of tinyML with the global community. Speakers from all over the world are invited to apply for giving a talk. And then here, I also would love to give a big shout out to the organizing committee members of the tinyML Shenzhen meetups who are coming from C Studio, Chaihuo Makerspace, and MarsCrowd. And then if you want to check out the recap videos of our previous tinyML talks, including this one, please subscribe to our official tinyML YouTube channels. We will share project updates, notifications, and then also other recap videos of the talks and more onto the channel. So don't just miss out. And then here, we will have our next tinyML talks, which will happen on the March the 1st by Anthony and Alessi of Gravity. They will share on speed up time to market with Aperture tinyML compiler. Without any further ado, let's meet our speaker today, Jallow, aka Luka. He currently works as a product manager at MarsCrowd. He is also the founder of All STEAM and also Megatech. Before switching careers from public health to computer science, Luka worked for more than 3 years as a public health official for the Ministry of Health of the Gambia. He spent most of his time at hard-to-reach health facilities in rural Gambia during this period. So now, Luka, the floor is yours. Please take it over.
Thank you, Melly, for the introduction. And I am honored to be given this opportunity to share my perspective with this wonderful audience. Good evening from China, good morning, good afternoon, whichever part of the world you are right now. Yeah, and thank you for being here. As, as it has already been mentioned, today we're going to talk about applications of tinyML, if you like, smart IoT in resource-constrained healthcare settings. Therefore, I will start with a famous quote that I modify. Daniel Akaka once said, a tremendous amount of needless pain and suffering can be eliminated by ensuring that health insurance is universally available. However, health insurance exists only in developed countries and some other metropolitan cities of low middle income countries. Therefore, I choose to modify this quote, and instead of health insurance, I said primary health care is universally accessible instead. This is because primary health care and basic education are non-negotiable fundamental human rights. So for the rest of this session, I will explore the following content. First, I will discuss existing healthcare challenges faced by resource-constrained communities, and I will use the rural Gambia as a reference since I have had first-hand experience working in these remote areas for over 3 years. Then I will explore a solution proposed by some experts, and then I will introduce the extension of these solutions, which I and few other Gambians are working upon. Finally, I will describe a few thoughts that one should often consider when developing a solution for healthcare. Talking about challenges, the first thing that comes to mind is lack of resources. This could be human resources, financial resources, technical resources, infrastructure, health information system, and etc. If I want to name all this list, we can spend the whole night talking about it. But just to give you some context, the picture you will see in this slide is a single public health official providing service to all those women with their children at that health setting. Like this single public health official, he will weigh each and every child, screen their routine vaccination requirement, and vaccinate all of them, and vaccinate all those who are due for their routine or subsequent vaccination. I have been through such kind of experience. For example, in a day, I will be required to vaccinate over 100 or 60 above kids every day in one session, which is quite tedious. Another constraint is related to budget allocation. I understand some countries have very low GDP, but if services are properly prioritized and resources are properly allocated, healthcare workers are well motivated. It might change the trajectory of primary healthcare in rural communities. Unfortunately, this is not always the case. Thus, these communities record higher preventable deaths every year. On this map, I try to compare the healthcare budget of the highest economic country of each continent. So just taking Nigeria as an example, is the highest economic country, is the country with the highest economy in Africa at the moment. And they spend only 3.0.3 of their GDP, annual GDP on healthcare. So what this will tell us is that depending on the amount of income or the amount of budget that we spend on healthcare, will also reflect on the health status of our communities. Then you will see, based on the WHO 2021 data, you can see that like in every year, the whole world records about 41 million deaths of NCDs. NCDs are non-communicable diseases. As I have mentioned earlier, low-income countries account for 77% of all these deaths. Among these deaths, like cardiovascular diseases takes about 47% of it. What is more fascinating is most of these deaths are highly preventable. And the key to intervention here is early screening, detection, and treatment. And this is my point of argument. And that's why I mentioned in my title, tinyML is more suitable for resource-constrained communities. To understand how tinyML fits in primary healthcare, we should understand some of the most common vital sign checkups that are routinely done in primary healthcare settings. There are more than 6, but I listed the 6 most basic ones. But don't be surprised if I tell you some of these services are not available in some primary healthcare centers. For example, if someone needs ECG test in the Gambia, he will have to go to a regional health center or hospital, but not even a district health center or a district clinic will be able to give him an ECG test. So what can we do as a community to help? Of course, there are so many things that have been done, and the community have been trying for so much to help most of the rural communities. However, there is still much more work to be done. And actually, this is what inspired me to be part of the tinyML movement. I realized that it has more to offer to the marginalized communities than other emerging technologies. Therefore, when we integrate ultra-low power devices in healthcare, it will enable health workers to efficiently record, monitor, and analyze patients' data without relying on any external or complex tech infrastructure. tinyML, in my opinion, is one of the best technologies that can bridge the healthcare gap between developing and developed countries. Looking at the portable device made by Subrat, it can record and monitor all the vital signs I mentioned above. Best of all, the device will not cost more than $200, given the boards and chips or sensors that are displayed on the slide. So it has met the purpose of primary healthcare, especially in resource-constrained communities. It is a device that can do most of the basic things and is quite portable and affordable. So according to her, the goal is to enable easy and reliable routine health checkups of rural inhabitants. The creation of medical database at the cloud platform for individuals facilitate better healthcare and enhance the quality of life of people residing in rural areas. And this is a noble and also inspiring goal to set. So I am as well inspired to extend her solution to meet the needs of communities I have been serving back in the days when I was practicing as a public health officer. So, but looking at her solution, most of the time, this is the problem with most interventions especially in African countries. Like most of the time, we import some solutions and bring them without having to understand what is actually going to work for those community people. Therefore, it will be difficult to have a one solution for all problems, especially in healthcare. It always has to be tailor-made for a particular community or for a particular group of people or for a particular people in a particular geographical area. So we always have to understand the challenges that those people in that community are facing before we start initializing solutions. And one of the challenges that communities in the Gambia, especially in the rural Gambia, face is like communication problems. They face communication problems because most of the adults in the rural settings are have not been to school, or they have very minimally, very basic education. Therefore, they cannot speak English, most of them. And most of the healthcare workers that are posted in these rural areas, most of them can only speak English and one of their native language. However, not in the Gambia, a tiny Gambia, it has about 8 different languages. So if you are a healthcare worker and then you are posted in a community and you can speak only one language, one local language, and English language, but those community members cannot speak your local language and they cannot speak English, what will happen is you will often need to get someone to help you do translation or interpret between you and the patient. And there could be a problem in this area. What is the problem in this area is most of the time, the individual that you call to be the interpreter is most of the time a community member. And healthcare is very sensitive. Healthcare data is very sensitive. Therefore, if I am having problems, I would not like to disclose most of my problems to someone who is living in the same community that I am. And as a result, I might even choose to hide my pain and my illness rather than to express myself to the doctor via an interpreter. So this is one of the challenges. And the other challenge is, since Gambia does not have so many qualified medical doctors, they most of the time have a partnership with other countries. For example, Cuba. We have been receiving doctors from Cuba for a long time, and most of them cannot speak any other language apart from their language, maybe Spanish or Portuguese, I forgot, and English. And their English as well is just a broken English like. So it was difficult for them to communicate with the patients. So which was like a huge barrier for people seeking healthcare. Another challenge that we might face when we want to introduce tinyML devices in the Gambia will be, where will we get the data to train those models? There have been so many research that have been done that have proved that if the data is not a universal representative data, the model will not always work the same way as it works with the characteristics of data that it is trained with. Do you understand? So what will happen is, if you train a model with data just from maybe people from United States, Brazil, or whatever in the Americas, and you want to introduce that same model for people in Gambia or in other African countries or in other Asian countries, the model will not perform very well, because they have the features are different. The features in their data are completely different because they have different features. So it's completely different. So it's a problem. So why is this a problem in the Gambia? This is a problem in the Gambia because you can see here, this lady is taking information of this baby, but she is recording all this information on a paper. And what will happen is, these papers are packed in cupboards and whatever, and it will never be utilized. There is no electronic information system where you will be able to have access to data easily and prepare some training data and stuff like that. So this is a very huge problem for healthcare settings not only in the Gambia but in most developing countries. Another problem will be the healthcare seeking behavior. The healthcare seeking behavior is like I have mentioned above, most of these non-communicable diseases are preventable. They are preventable if you seek for help for healthcare, if you seek for healthcare assessment earlier, or if you seek for treatment earlier. But what happened in these communities, most of these rural community members, they are not very aware of their health status. And then they often do not come to the hospital or to the clinic at the right time. They only come to the hospital or at the clinic when they are really, really sick, and whatever kind of intervention that you try to make, you might not be able to help him or her. So this is another challenge that healthcare workers are facing in the Gambia and other developing countries. And another part is hardware and internet. Yeah, we talk about IoT, but if there is no hardware available and if there is no access to internet, so this materials become very useless, because if you develop a system that requires like a very high bandwidth of internet, or you develop a system that requires very huge like constant or a high voltage of power, maybe you will not be able to use this kind of equipments in those rural settings. So what will be the solution? The solution will be to create devices that will be able to function offline if there is no internet and still remain connected, or like they can sync to the cloud later when there is internet available, but even though let them be able to compute on the edge, like locally without any internet, and also develop devices that will be able to do very well without having to consume a lot of power. So this will be the ideal solution for this kind of problem. So this is why we choose to modify the previous solution, the previous solution that was introduced by the other experts. So what we want to do is to eliminate the communication problem, which is our ultimate objective at the moment. We started a project whereas we are collecting some audio files, some audio data from Gambians to prepare to put together how would I call it, a data set for an automatic speech recognition system, which will be able to work offline. So basically, we have 8 languages in the Gambia, but at this moment we cannot make a system that can work for all these 8 languages. So we're going to take it step by step, and that is why we choose the language that is most commonly spoken, which is Wolof. So at this moment, we are collecting data for Wolof. And what will happen is our system will work like this. When we integrate this system on that device, what will happen is when there is a patient that cannot speak a particular language, he will be able to communicate with the doctor without having to use an interpreter. Then whenever he speaks to the doctor in his language, the system will translate that audio to English, and then the doctor will understand the problem of the patient. Likewise, when the doctor wants to explain something to the patient, he will speak on the system in English, and then the system will translate what he said in the targeted language, and then the patient will understand without having to have anybody to interpret for them. Yeah. So far, what have we done? So far, we are still on the data collection section. That's why we are not going to introduce any model training in this talk. Later in the future, when we finish training our model, we will share it with the community as well. But at this moment, we are just doing the data collection. So when we finish doing the data collection, what we want to do is we just want to label the data because we already have some other data which was in English. So we want to pair this local language data with the English language so that it will be easy for us to work with. And then after that, we're going to train our model. Then from there, we're going to evaluate the model, then deploy it on the system. Then when we finish with the Wolof language, we're going to change to another language, and that will be Mandinka, and then so on. So this is basically our roadmap at the moment. And we are still at this point here. Yeah, so finally, what are some of the thoughts that I have in mind, or that actually these are general thoughts that anyone should think of whenever you are trying to develop a solution for healthcare? One of them is security and privacy. I cannot overemphasize this. In terms of healthcare, the privacy and security of healthcare data must always be maintained. Like unauthorized access should not be permitted. And then we should always be able to know how we use this patient's data. We should always keep the patient's data private and all those things. And this will also improve the trust that the patients have on the healthcare on the healthcare service. For example, if you look at it right now, like so many people have like vaccines skeptics because they have received so many fake information about how their data or how whatever is being used. But if you develop a system that is already, if you develop a system that emphasizes on these major things, it will be acceptable. Like it will be acceptable by the community because you are preparing this system for the community. Therefore, it will be acceptable. Another thing that we cannot overemphasize will be the regulation and standard. So healthcare is very sensitive. Like you cannot accept mistakes in healthcare. You cannot say, okay, I'm going to operate someone, and then you are not well prepared or you are not a highly qualified doctor, and then you say, oh, it's a mistake. No, if you just make a mistake, you cause a life. So that is why, even for example, if we finish developing our system, we really have to make sure that we have a standardized body that will be able to test these equipments without any string attached, and be able to tell us the truth whether this equipment will fit the needs of this particular problem. Yeah, we really need to standardize the development of healthcare equipment. And then also, if we want to develop devices for these marginalized or these low resource communities or hard to reach communities, it is very important to make that system affordable and portable. Affordable in a sense, I've already mentioned this thing. Resources or their economic status is a problem. Therefore, if you want to make a device that is very expensive, they will not be able to afford it and they will not be able to maintain it. So therefore, always if we are trying to make a solution, let us keep these four things in perspective. Let us always try to ensure that we have let us always try to ensure that the system is affordable and portable as well. And then, well, this should have been the first thing I mentioned. Whenever we try to create a system or develop a system for healthcare, it should be for goodwill, and the solution should have some wisdom. It's not just based on a mere thought or something like that. It should be for goodwill and have wisdom. Like in general, healthcare applications have clear definition, objective, and goals. Like the main goal should always be the general good rather than profit. So if we really want to make profits in healthcare, we might compromise the lives of many other people. Of course, I'm not saying like healthcare devices will not be profitable. I'm not saying that. But what I'm saying is, I mean, we should prioritize the well-being of the people over the profitability of our equipment. Yeah. So I think it's so fast. Basically, this is what I have to share with you today. And yeah, thank you for listening to me vibrating everywhere. I don't know how to say this thing, but then yeah, thank you for your kind attention. And if you really want to get involved in our project, yeah, feel free to contact me, or yeah, reach out to me on LinkedIn, or you can email me, or you can contact me on my work email as well, momodu@marscrowd.com. Yeah. Likewise, if you want to join our course for STEAM education, you can also go to our website, allsteam.org, and we can get in touch. Yeah. So I'll hand over the control over to Melili, and if you have any questions, feel free to ask me questions, and yeah, I will try my best. The questions based on my
Okay, thank you, Luka, for your sharing. And then now it's time for question and poll. So if you having any questions for Luka, please use the Q&A feature in Zoom, and then we can take some questions. And then if no, actually, Luka, I have one question for you. Like you have mentioning that you will, after like finish training the collecting the data and then training the model, you will deploy it in a custom device for the real use, right? So what kind of devices will it be?
So the device will be similar to the device I introduced earlier in the other slide. Can you go?
Yeah, I already agree. Yeah, you can change it.
So basically, our objective is to improve or to build upon this device. This device have already been developed by this lady in India. So we already have we already know what they have done so far. So what we are trying to do is we are trying to improve this. So we're gonna add some other features here. So what we're gonna add here is we're gonna improve on the screen, like the screen feature here. We're gonna increase the screen, the monitor of this device. We're gonna increase it a little bit, and then we will add a microphone and also a speaker on it, so that it will be able to do the automatic speech recognition system.
Okay.
So basically, I did not assemble it, but most of the things that I don't know whether you can see.
Yeah.
Most of the things that are already here. Like we've already been working on it. We have tested it several times, but we still need to add more other sensors on it. That's why I did not assemble it or to show it to the community. So I want to wait until when it is ready, then I will share it with the community. Yeah.
Okay, got it. So the device is not just only for like language translation, right? It's also using for like to collect some data for
exactly
health monitoring, right?
Exactly. So what it will be able to do is it will be able to get your temperature, your impulse, your blood pressure, and it will be able to measure the ECG and all those stuff, the blood oxygen and all those stuff. So it will be like a one tool that one facility can have, or one primary healthcare facility can have, and they will be able to do all those things at the same place, without having to go from one point to another, from one point to another. Yeah, this is the objective. Yeah.
Okay, I got it. I also send. Could you click the Q&A session of Zoom? I think I saw one question in the session.
Where can I find it?
Maybe you can like drop out the control, then I can check it out. Here.
Okay.
A question from Mark. Are there any similar language barrier issue anywhere else in the world in the solution space related to healthcare challenges you are currently trying to solve in Gambia?
Yeah, I would say yes, because if you look at it, if you go to the World Bank data, if you look at the literacy level, the adult literacy level of most of the developing countries is less than like 80%. Do you understand? So it means there still exist people who cannot speak like maybe English, or there still exist people who cannot speak all the languages in their country. Like some countries, for example, Nigeria, they have more than 100 different languages. Gambia alone have 8 different languages. But fortunately for me, I can speak 4 different languages in the Gambia, but we have 8. But fortunately for me, I can speak 4 different languages. So I did not actually face this problem, but I have seen many other health practitioners who face this problem because they can only speak English or one other language. And then these communities are divided into ethnicities. And maybe if you are posted in one community, maybe this community can speak only this language. And if you cannot speak that language, then you really find it difficult to communicate with the community members. So I think a similar thing is happening around the world in most of the developing countries as well, especially where you don't have a universal language as the Olena. Of course, in the Gambia, English is the official language, but it's not the spoken language everywhere. But even though it's the official language. So I think similar things are happening in different parts of the world as well.
Okay, thank you. Okay, I think we are having like the time for the Q&A is kind of up. So if you are having any follow-up questions for Luka, please feel free to contact Luka through emails listed here on the slide. And also you can go to our tinyML forums to continue the conversation and for further discussions. So thank you again to Luka for having such a meaningful sharing. And last but not least, we'd love to express our gratitude again to our tinyML strategy partners. For our executive strategy partners, the Software and Hardware Foundation for tinyML, H-Impulse, the leading ML platform, Qualcomm, advancing AI research to make efficient AI ubiquitous, Centennial, end-to-end deep learning solution for tinyML and Edge AI. And to our Platinum strategy partners, DeepLight, we use AI to make other AI faster, smarter, and much more power efficient. ClickAttack, global IoT solution. And then also Reality AI, add advanced sensing to your product with Edge AI tinyML. Renaissance, broad and scalable edge computing portfolio. And then also to our Gold strategy partners, to PhotoHub, and to Messing Integrated, enabling edge intelligence. And then also Lantern AI, adaptive AI for the intelligent edge. And then to Micro AI, NSP, and also to Systio, deploy tinyML into the real world, plug and play machine learning. Sensio, build smart IoT sensor devices from data. And also ST Microelectronics, ThinkSense, and then also to our Silver strategy partners, add-on devices, Amazon Visual Sense, Brainwaves Technology, Gravity Inc., HOTG, ImagineMob, Itemus, Prophecy, Osio, Reason, SAP, and also String Analyze. Okay, once again, do not miss out our next tinyML talks on March the 1st by Anthony and Angrecy of Gravity. They will share on speed of time to market with Africa TVML compiler. Okay. Thank you everyone for joining us for this tinyML talks, and we will hope to see you next time. Thank you, Luka.